Hi, welcome to Women's Health. I am Jeanne Schumacher, co-founder of the Pregnancy Advantage, where we help women to get their bodies pregnant ready. Or if you're having trouble conceiving, we want to help you there too. My partner is Dr. Debra Shapiro, who is a board-certified OBGYN. And today's topic is a big one because I can't tell you how many women I know, even just growing up, who have issues with irregular menstrual cycles. So Doc, you ready to take it away?
Yes, absolutely. Irregular periods is definitely something that we see all the time in normal gynecologic practice. It's a very common issue. And I think we might have some insights into why this is happening that you may not have thought of before. So first, let's start with what's normal. So most women have menstrual periods that occur about every 28 days. I know people sometimes wonder why it isn't exactly, but we're not like a Swiss watch. We're just humans. So we can be off by a couple of days, but approximately every 28 days is very normal. But actually anything from every 21 days to 40 days is considered normal. So, and then we count from the first day of one till the first day of the next. Also, bleeding can last usually 4 to 7 days. Often the second day is heaviest. Sometimes you can have it for a few days and then not have it for one day and then it comes back. All of that is normal. It's normal to have just 1 day of bleeding. Oh, you're so lucky. I used to bleed very, very heavily and it was still normal. So we are much more concerned with too much bleeding in general than too little bleeding for a period. We don't like women to bleed more than 8 days, for example. And when you're young, less than 35 years old, and you're slender, we might not be as worried about the risks of irregular bleeding and prolonged and heavy bleeding as we would be as if you were older or heavier, because when you are bleeding heavily, it could be a sign of some overgrowth of tissue inside the uterus, which is called hyperplasia, or even uterine cancer. So one of the signs of uterine cancer or something wrong inside the uterus is too much bleeding. And we do worry about that, especially when women are older, or if they have a history of polycystic ovarian syndrome, which we'll talk about, and which we have talked about, I think, last week, and also if they're obese, because there's more estrogen acting on the lining of the uterus, and that can make this overgrowth, and the tissue can actually become abnormal. So some examples of some other kinds of menstrual problems, not just irregular, would be, well, because it also includes irregular, but also infrequent periods. We call it oligomenorrhea, or missing a few periods in a row. It's not uncommon if you just looked at all women and you just looked over a year, maybe to skip one or skip two. That's very normal. It could just be a stress happening. You're moving, you're traveling. How many kids go to camp and then don't get their periods? So that's very normal. But if it's routine that you really only get a couple of periods a year, that's called oligomenorrhea, and that is not normal. You could also have very, very heavy flow or prolonged flow, and that's called menorrhagia, and that can be a sign that there's something going on inside the uterus, like a polyp or a fibroid that could be contributing to heavy bleeding that's benign. Periods that are accompanied by a lot of pain and cramping and even nausea and vomiting, which I have had. This is called dysmenorrhea, or painful periods. And this can be primary dysmenorrhea if it's just, a young person who has terrible, terrible painful periods, or it can be secondary dysmenorrhea, which is when it's caused by another medical problem like endometriosis, for example, which is often associated with very painful periods. The pain that comes with endometriosis, we talked about last week also, it's not just pain sort of on the second day, it's pain that starts before your period and goes all the way through, and very unusual for just primary dysmenorrhea to show itself like that. And then you could also have bleeding or spotting between your periods. That intermenstrual spotting, or they call it metrorrhagia, or pain in the middle, that can occur after intercourse also, which is called postcoital bleeding. But this needs to be worked up. If you just have a day or two or even 3 of spotting, light spotting, right in the middle, right? 2 weeks before your period, right associated with ovulation, that's very normal. There's a little dip in the amount of estrogen. You can get a little bit of spotting mid-cycle, and that is not a problem. But if you're having sort of, 2 periods a month and you're really getting, 4 or 5 days of bleeding right in the middle, or you bleed after intercourse all the time, this should be checked out, because it really can be from something that's not so healthy going on with you. So some very common causes of irregular cycles are stress. Very big cause of skipping a period and irregular periods. Significant weight changes, either gaining a lot of weight or getting super, super slim and losing a lot of weight. Also, obviously, we didn't even talk about it yet, but perimenopausal bleeding is, by definition, irregular bleeding. So being perimenopause, being around the time of menopause, and the time of menopause usually is around 52 in this country, 51, 52, but you can be around the time of menopause, from 45. Well, and you can have menopause from 45 to 55, but even in the years leading up to it, so even when you hit 40, you can have some irregular bleeding sometimes. So thyroid dysfunction and other endocrine dysfunctions, even problems with your adrenal glands, that can cause irregular bleeding. Other hormonal changes like increased prolactin, which is the hormone in your brain that makes milk. So this can absolutely suppress your periods and cause irregular bleeding. Cervical lesions. This is very common also when you notice bleeding after intercourse or intermenstrual spotting. You could have benign lesions. You could have polyps from the cervix. You could have actually dysplasia or abnormal cell growth, or even cancer of the cervix that can cause irregular bleeding. You can have benign changes, something called ectropion, where the cells that line the inside part of the cervix actually come out onto the outside part of the cervix, and it looks very velvety, and it just bleeds very, very easily. Your doctor on a pap smear might say, oh, you have this ectropion, and you might have a little bleeding after your pap, but it's very normal. So you might, if this is happening to you, you might also notice some bleeding when the cervix gets bumped. Also, cervical and vaginal infections. So chlamydia can cause bleeding. Gonorrhea in the vagina might cause some bleeding. If you have pelvic inflammatory disease or infection inside your organs, they may also be associated with irregular bleeding. Endometriosis we talked about, and also adenomyosis. Adenomyosis is when the lining of the uterus, the endometrium, implants deeply into the muscle wall. You see these when you look on ultrasound, you can see what looks like endometrial implants inside the muscle wall. It usually causes heavy and sometimes prolonged bleeding and painful periods, because you can imagine you're bleeding inside of the muscle wall of the uterus. It's a very painful condition, sometimes more difficult to treat. So we talked about pelvic inflammatory disease and, of course, polycystic ovarian syndrome. There are also medications like steroids that can throw off your periods quite often. Anticoagulant drugs. If you're on a blood thinner, you might bleed very, very heavily. You really have to worry about those. Birth control pills, we usually put people on birth control pills to control irregular bleeding, but sometimes people get breakthrough bleeding on the pill that is very annoying. Also, IUDs, intrauterine devices, can contribute to irregular bleeding. Ovarian cysts can sometimes delay a period, like a corpus luteum cyst might delay a period. So ovarian cysts. And also, not to forget our older patients who are already menopausal, having vaginal atrophy. It's not, certainly this is not the group of people that we normally talk to for the pregnancy advantage, but they're a big part of my practice and always have been. And so vaginal atrophy, when there's less estrogen acting on the lining of the vagina and on the vulva, you can easily get mucosal tears. Sometimes not even caused by anything, just happen, but certainly caused by intercourse, and they can bleed and be very painful. And then we did mention earlier uterine hyperplasia, when there's too many cells built up in the uterine lining, and they can actually, sometimes they're benign and sometimes they're not. They're actually turning and they're becoming a precancer or a cancer of the uterus. Also, cancer of the ovaries and of the fallopian tubes can also be associated with, among other things, obviously it's not a main sign, but it can be associated with irregular bleeding.
Wow, Doc, did you take breath in there at all? That was impressive, honestly.
Thank you. Well, now you know it all. You don't even need to go to your gynecologist. No, you do. If you have irregular bleeding, still go to your doctor. But it's good to sort of have it in the back of your mind that you have some idea of how to think about it. Endocrine, your brain, and your uterus, and your tubes, and your vagina. These are all sources that can be contributing to irregular bleeding.
Right. And another one is period pain and acne. Oh my gosh. Consuming dairy can have a huge effect on period pain levels, especially if you're prone to like these really heavy periods. And I remember several of my girlfriends really having heavy periods. And, you know, or if you have things like endometriosis or PCOS, that's polycystic ovary syndrome. And we both just did on both of those topics, we just did a whole women's health on that. You can find that on my YouTube channel, Jeanne Schumacher, Simply Plant Based. But you need to understand, first of all, cow's milk, it's not, a cow is not your mother, just saying, okay? And a cow's milk is going to contain over 60 different hormones, including testosterone, insulin, and protein called A1, casein, okay, which can cause or increase inflammation in your body. Cutting out the milk and other dairy products can help you improve your cramps and prevent acne. Win-win.
Absolutely. You know, I wish that I had known this when I was growing up, because I drank milk. I drank lactose-free milk when I became lactose intolerant. I continued to eat cheese. I would just take those lactate pills and I would eat a lot of cheese. And I really suffered. I suffered from irritable bowel, from constipation as a young person. I suffered from terrible acne, and I suffered from very heavy periods. And I never made the connection. You know, I had to sleep on a towel for my second day. I would always be dragging my sheets. Dragging my sheets to the sink to wash because I couldn't, it was very heavy. And my patients, I have multiple times told patients who are suffering from heavy periods just to get off the dairy, and they've come back and said, wow, you know, that was brilliant. And it really isn't brilliant. It's just that, you know, what is in cow's milk? I mean, it's just a lot of hormones that is really, you know why? Because we now have modified our cattle so that they produce milk while they're pregnant. So you can imagine now high levels of estrogen and progesterone, and there's other hormones, other female hormones, and even male hormones that you're taking in that you do not need. These are definitely, you know, people always worry about, you know, oh, the hormones in soy, you know, I don't want to have the hormones in soy. Well, hormones in soy, that's a plant hormone and it works very, very differently in humans. But mammalian estrogen from dairy, that's pure gold. So that will make your periods heavy and oily. And now it's so much easier now because we have so many dairy alternatives too. So it wasn't easy maybe 20 years ago, but now, boy, you can still enjoy it. It's a little high fat, and I'm not promoting it, but I'm just saying you won't have to be depriving yourself of anything. There are incredible plant-based cheeses now that will blow you away. Right? So, and of course, everything. I mean, every kind of dairy. You can get butter. You can get kind of cream cheese. All this stuff. It's all available to you, dairy-free. And I would highly recommend it if you are suffering from heavy bleeding. That's the first thing I would do. So, I guess we're talking now about how to get lighter flow. Moving right into that, right? So, one, really just getting rid of animal products, because there are all these hormones in these animal products. And so just going plant-based will make a huge difference. And I would just recommend anyone is suffering from any kind of menstrual problem, just go plant-based, do it for a month or two and see what happens to your periods, because you will be pleasantly surprised. Also, when you're going plant-based, and especially if you're going really whole food plant-based and not just eating vegan like chips and Coke, which is vegan and Oreos, but you really are eating a lot of whole plant foods full of antioxidants and phytonutrients and micronutrients if you're eating mushrooms, and polyunsaturated fatty acids from nuts and seeds, especially in avocados, and the plant sterols and stanols, these chemicals that are very helpful for us. You know, there are over 100,000 phytonutrients in plants, over 100,000. So it's not like you know, there are 100,000 phytonutrients, and they all do things that are a little bit different, and they work together to make us healthy. So including those phytoestrogens and also fiber that are all great for our health when consumed. So you want to reduce your inflammation. A lot of the pain has to do with inflammation. You want to reduce your oxidative stress. That's by eating a lot of antioxidants. You want to increase your insulin sensitivity and make your periods regular and lighter. And also, by reducing your animal products, you're also going to be naturally reducing your toxin load, these endocrine disrupting chemicals that are estrogen-like chemicals that are in animal products, especially fish that are filled with, especially farm fish that have PCBs and dioxins. These are estrogens. Again, these are the endocrine disrupting chemicals. They act like estrogens in our bodies, and they promote cancer as well. So fish is a huge source of heavy metals, because you know my story. I had mercury poisoning twice from eating too much fish. And also in your personal care products and in the materials that you keep your food in. So avoiding BPA, which is another endocrine disrupting chemical that acts like an estrogen and is an obesogen. Phthalates that are in scented products, the parabens, the PFAS, per and polyfluorinated alkyl substances. You'll be reducing your exposure to, there are actually over 1,000 endocrine disrupting chemicals that are in our environment today. And these will affect your hormonal system and can affect your cycles. So you want to eat a variety of whole plant foods every day. Fruit, vegetables, whole grains, legumes, nuts, and seeds, and spices. There is no reason, and it's not healthy, to restrict your diet significantly. You don't need to eliminate an entire food group, like, oh, I don't eat grains. I mean, it's ridiculous not to eat grains. Grains are a very rich source of fiber and of all kinds of phytonutrients and B vitamins. And you need everything. You need everything together. That's why it's wonderful to be human, to be able to eat all of these whole plant foods. Now, if you actually have celiac disease and you cannot have gluten, or a wheat allergy, or a gluten sensitivity, then you can eliminate gluten. But there are plenty of non-glutinous grains, and it's really just a few that have gluten. So enjoy all the colors of the rainbow every day. You should try to eat 50 different whole plant foods every day.
So true, Deborah. So true. So another thing that is an issue for irregular periods is the blood loss that we experience during our period. And losing blood means that you're going to lose iron too. And being plant-based, you do need to be a little bit more conscious of your iron intake to, keep it topped up. Things like tofu, leafy greens, and lentils all are so rich in iron. And your body absorbs iron best when it's combined with vitamin C. So, and by the way, I just wanted to share with you that you can increase the amount of iron that you're getting by cooking in a cast iron skillet. So, especially things that are a little bit on the more acidic side, like for example, tomatoes, like a tomato sauce, things like that, that's going to really absorb the iron. So there are two types of iron. There's heme and non-heme. And Deborah, would you take over and explain the difference to our viewers?
Yes, absolutely. So heme iron is the iron that you're going to find in meat. And our bodies, it's fascinating, our bodies cannot modulate the amount of heme iron that we absorb. And you may even get too much. And the problem with having too much iron is that it gets stored and it can actually contribute to Alzheimer's and dementia. So it's one of those heavy metals that you do not want to have too much of. And there's actually a disease called hemochromatosis where you actually do have too much heme and iron. On the other hand, plant-based iron, non-heme iron, our bodies absorb just what we need, just the amount that we need, and we don't absorb the rest. So getting your iron from plant sources, unless you're really anemic. If you're anemic, you might need to take, I'm not saying you should eat meat. I'm just saying you might need to take a supplement or cook more of your food in an iron skillet to absorb more elemental iron. But if you have a normal hemoglobin and hematocrit, then you should be able to just eat whole plant foods and watch for things like Jeanne was talking about. Like when you're eating spinach, put some lemon juice on it or put some vinegar on it or have a tomato sauce on, with your greens as well. So that's the difference between heme iron and non-heme iron. It has to do with absorption. And one other thing about acidic foods, because you're mentioning it, is also when you get your tomatoes, watch out for getting tomatoes in cans that are not BPA free, right? You want to get non-BPA lined cans. And acidic food is going to be higher in BPA than non. So get your canned tomatoes from non-BPA lined cans and enjoy your iron-rich foods with a source of vitamin C. It's the same reason that you would want to be eating your foods that are high in fat-soluble vitamins with a source of fat. So when I'm having a lot of greens and I want to absorb the vitamin K, for example, from the greens, you can't just have greens alone. I mean, it's fine to munch on them, but if you have them all by themselves, you're not going to be absorbing those fat-soluble vitamins. You need a small source of fat. That's why we don't talk about, this is not a non-fat diet, not by any means, but you want to eat your fats as they are contained in whole plant foods. So make your dressings from tahini, from sesame seeds. Have some, sprinkle on some almonds or put almond butter in your smoothies, right? So try to get a source of fat. Have hemp seeds, have chia seeds, have flax seeds. I always put flax seeds on my salads too, or in my smoothies. So a source of fat with any kind of green or a bean where you're trying to get those fat soluble vitamins also. That's important, especially with greens.
Okay, well, we have a question from Shalini, and I don't know if I'm saying your name right. I hope I am. Langley. So welcome to our show. She wants to know, do we recommend a steamer? Well, I think the Instant Pot is like a game changer. If you don't have an Instant Pot, I strongly recommend not one, two. Get two of the same model, because you're going to find yourself cooking in it. I batch cook all the time in my Instant Pot, literally. And on Sundays when I do a lot of my batch cooking, they're going all day long, like I'll take something out and then I'll have it ready to go for the next thing, whatever I'm cooking, whether it's, I usually have in my fridge some kind of potatoes, grains. I have either a lentil or beans, chickpeas. Oh my God. I started making Debra these air fried chickpeas. Oh my God. I mean, it replaces potato chips. If you have that craving in the evening, especially for, women that want to get pregnant, because we know that you're going to need to increase, especially as you get pregnant in the second and third trimester, you're going to need to increase your protein. So these chickpeas, oh my God, not just protein, but fiber too.
We roast our chickpeas on parchment paper, but even roasting and even the air fryer, it can probably increase the advanced glycation end products. So if you're trying to deal with PCOS and you want to reduce your advanced glycation end products in your body, the AGEs, then you would want to do more steaming and boiling instead of roasting. But I'll give you an example of why I prefer the Instant Pot to steaming, and I steam. But I put something up, I put some greens up for steaming, and I walked away. And I burned the pot, and it was a disaster. And this is me because I'm a little bit absent-minded. I get busy, I'm writing and I'm reading, and I'm just not thinking about what I put on the stove. So the beauty of the Instant Pot is that you put something in there and it dings. There's an alarm that's going to go off when it's ready, especially for steaming, because you just want to put it on high pressure, 0 minutes, and then do an immediate release of the steam, and then it will be perfect. But the other thing about beans and cooking anything in the Instant Pot is that you can just set it up and walk away, and it will be done staying warm. And when you come back, it won't be burned. It's just it won't be boiling over. I mean, I used to make all these beans and things on the stove, and even grains that you have to boil first and then lower the heat to a simmer. If you're not watching it, it's going to be such a mess. So the Instant Pot is a time saver, and it's a cleaning saver, and it's fabulous. Yes. Fabulous. So I would recommend it. But yes, I've used bamboo steamers. I've used steamers. Definitely, you can't just set it up and walk away. You have to test it. You have to make sure you're getting it just right. But this other way that I learned actually from Chef AJ, you put a little bit of water at the bottom, put the steamer thing on, load in your greens, and I've got a big one, so you can load a ton of greens in it because it really goes down. High pressure, 0 minutes, and as soon as it goes off, that it's reached it, you just let the steam out with a towel over it, and you've got these perfectly steamed greens.
So do you have a steamer basket that you put stuff in?
It comes with a little metal tray, so I just load it on top of the tray.
Oh, okay. I thought you had something special, and I was like, ooh.
No, I did buy something, but I just use that one. It's good. It's fine, and I don't put much water. So actually, you can also steam, right? You probably do also, if I'm doing a sweet potato or something, yeah. I'll steam it. But this other way that she taught of just doing pressure cooking, high pressure, but 0 minutes, and then just do the quick release. They are perfecto. And boy, after burning, the other thing I was thinking about, if you're making pasta, there are some pasta dishes that also have a steamer attachment. So if you happen to be boiling water and steaming your pasta, you could also put some greens on top, and that would probably be fine. And you're watching it anyway, so that would be fine as well. So there are ways sort of just to to save time by doing things together, right?
Well, but also I had before, when I first started getting into this, I had bought this little steamer that I think I got it at Kohl's or, Bed Bath & Beyond, one of those. But the whole thing was plastic. And while it made it lightweight and it was easy to transport, when you're steaming in the plastic, I was very concerned after, learning, and doing research and stuff like that about the chemicals that are being leached out into the steamer. So I would strongly recommend, something that if you're going to be doing something with steaming, that you use metal. And I also remember back, like we have those little collapsible folder things that you can put into the bottom of just a regular pot. Any pot that you have, it fits right into the bottom of it. You put a little bit of water in, that's all you really need is one of those steamers. But you want to make sure it's metal, because I've seen them like at Bed Bath & Beyond or other places, plastic. So I'd be careful about using any kind of plastics around that level of heat, because it goes above, like 100 degrees Celsius. It goes above that because it has a lot more energy. Well, it doesn't go above the temperature, but it has a lot more energy into it because it's stepping up,
I can't believe that they sold plastic. I have a silicone steamer that I think I bought for the Instant Pot, but I've never actually used. Now we've used bamboo. In the past, I've used bamboo steamers and those are fine. Right. So that's good. But yes, do not heat up plastic. Just like we don't put plastic things in the microwave.
Yes, that's a whole other conversation. So
right. Heating up plastic does you don't want to do it.
I know. I'm not a big fan. And and I saw this the other day that we had gotten together for a group, and somebody brought in now this was a while ago because we're still not getting together, but they had brought a crock pot and they had put a liner in it of plastic and then started it cooking at the place we were at.
Oh, no. Oh my goodness. Wow.
I know. And I'm just looking at this going, yeah. And I'm looking at this plastic liner inside of this crock pot, and literally it was boiling inside of the crock pot, that it had been heating up for a while. And I'm looking at this going, wow, thinking of all the chemicals that are being leached out of that plastic and going into the food. And I understand, and I think the person was doing it because of cleanup. It just makes it easier to just pick up the plastic and dump it out. But I'm just a little concerned about that. So
parchment paper makes all the difference. Buy parchment paper, and you line your baking pans with parchment, and it's very, very, very easy, and it's safe. So I would use parchment. Actually, when I learned how to cook without oil and just roast on parchment, it really changed everything. It changed my lipids, it changed my weight, it changed everything. So you don't need to cook with oil. You just need the parchment paper. So wow, that is amazing. The funny thing about plastics and being exposed to plastics is you don't notice it, right? I mean, it's not like burn yourself and you gotta burn and you can say, whoa, that hurt. But when you're exposed to plastics at low levels, you might never know what's harming you.
Well, and Shalini had said she has a steamer but it's not BPA free, So that's another concern, because here's what happens. Wait a minute, she says, does it say it is not? She says it's not BPA free. Even if it did say BPA free, I just want to tell you, because what they do, the BPA molecule is a very, very large molecule, okay? And what happens is they break off a little tiny piece of this molecule and replace it with another chemical. So technically they can say it's BPA free, but it's not really. It's still doing the same things that BPA does. And as Debra said, it's an endocrine disruptor. And your endocrine system, like, that runs everything, especially for a woman. We're complex beings. Just ask any woman, they'll tell you straight up. Men, on the other hand, kind of straightforward. They have simple algorithms that they're programming, No, it's true.
Endocrine disrupting chemicals affect the sperm too, but they're being made all the time. But for women, you're absolutely right. Please do not heat up plastic, any plastic. Don't cover things that are hot in saran wrap and just let it touch the food. It's really, metal is safer, and not any metal. I mean, you don't want to cook in aluminum. I mean, really, right. You have to get stainless steel and
food grade. Food grade.
Yes, stainless steel, and be very careful about this. Put things in glass containers, especially acidic foods like tomatoes. You don't want to put in plastic either. Anything that's going to stain the plastic, you know it's not right. So I would actually get rid of these dangerous plastics. And I've been noticing when we get takeout sometimes, it's in these plastics.
Yeah.
I'm not doing it anymore. But you know, I'm already 60, right? So it doesn't matter. But especially if you're young, they've done studies. I don't want you to think this is trivial. This is not. The way the amounts of chemicals that we're exposed to is having an effect on your probably on your microbiome, but definitely on your epigenome, on your DNA, and causing epigenetic changes. So this is known, it's understood. It's not like you have to be exposed to large amounts that the EPA says is poison. It's not about that. It's not about poisonous levels. It's not about levels that are, it's small amounts that we are being exposed to. And that's what the Pregnancy Advantage is about. It's going to teach you how to eliminate these as much as possible. We live in a very toxin-full world, but you can do whatever you can to eliminate, especially before you reproduce, to make the next generation healthier and smarter and happier and more free from chronic disease.
That's what our program is about. And we also have a gift for you. If you go to pregnantready.net, you can find the top 3 things that Debra and I think that you should be doing to get your body pregnant ready. So Debra, thank you so much for another wonderful topic on women's health. And we will see you on the next show, a week from today, same time, same channel.
Yes, absolutely. Thank you, Jeanne. Thank you for your knowledge.
Bye-bye.
Bye-bye.